Good morning, good afternoon, good evening. This is Dr. Garais, BIO116, Anatomy and Physiology 2. And this is Unit 4, which is Female Reproductive System. And right here we fast forward this. This is Vicky. And we, of course, used the visibility button, and then we selected urinary reproductive. So you could see here that part of urinary reproductive is the mammary glands. And let's remove the mammary glands. Okay, I just deselected it. And if we're looking at this, you could see how, and let's make this a lot bigger. You could see how that you have your kidneys, and then of course your ureters, and then your ureters goes into your urinary bladder, and from the urinary bladder, you now have your urethra, if it will select it. There you go. So you could see how it's totally separate from the genital system. Hence, but unlike the male, they're both called the genitourinary system. But in the male, it's kind of combined. In the female, you can see there's separate kidneys, ureters, urinary bladder, and then of course finally the urethra. So let's remove the kidneys and ureter and urinary bladder. So I go back into the visibility tool, and then I deselect, and then all I have is my things here. And if you want to know just a nice little review from Anatomy and Physiology 1. If you want to know the parts, you just click on, the category, and it'll tell you, right, of what organs, what things, and of course, what ligaments. Okay. So let's now look at this. And if you would like to look at the uterus, once you click on it, you could see that there is a covering that's covering not only uterus, but the fallopian tubes and the ovaries. So let's remove that layer, and we use the Explorer tool right here. Then we hit this button right here, and then whatever we click on next, that's what disappears. And that is the right broad ligament, and then of course I'm going to remove the left broad ligament. So the broad ligament covers the ovaries here, uterus here, and the fallopian tubes. Sorry, misspoke a little bit. Okay. Sue me. It's the end of the day. Alrighty. Now, you will also notice that there are a whole bunch of other ligaments which we'll go over last. So let's now that we see the fallopian tubes, do you see the expanded end of the fallopian tubes? Right? This part right here, that's the infundibulum. That is the location of fertilization. Ovaries, of course, here, and the uterus here. The uterus has three main parts. On the very top part is the fundus. The main section is called the corpus or body. And this part here, which we'll see a little bit better when we look at a mid-sagittal section, this is the vaginal canal right here, and then this is the uterus. Now, if you notice that the uterus and the vaginal canal, they have this marble-like appearance. This marbleization is due to the smooth muscle that the uterus and that your vaginal tube has present. And you could, if you recall, the Anatomy and Physiology 1, how it looks very different than the skeletal muscle. And remember, these muscles here are involuntary, therefore they're under autonomic nervous system control. Okay. Now, let's dissect and look at the uterus a little bit clearer. So we can take this, we can take our blue dissection tool, and then we cut along somewhere a little bit off center. Then I tap the item that I want to disappear, and I can see this. Now you could see the parts of the uterus a little bit better. Of course, the fundus at the top, main is the body, But if you look here, right here, this section right here, you could actually see the cervix. Okay? That's that part right there. I really should get a pointer. Now, we can also notice, once we dissect it, we can also notice the 3 layers. You can see how there's on the very outside, there's like an outside skin. And then the majority of it is the myometrium, or the muscle part. And if you look right here at the center of the screen, there's like a little hole, and that's the hollowed out middle section, which is the endometrium. And the endometrium is the location where the blastocyst will implant. Okay? And you can see here another view of the vaginal canal, right? And a little bit of the folds called rugae, but not as clear as they would on the textbook. Now, in order to get everything back to normal, I undo the cut, and we're now back to here. Now, that's all the internal genitalia. This is kind of internal. Trying to switch hands without. If you see this portion right here, it's cooperating with me, but it isn't. That is your clitoris. Do you notice the clitoris shape is a similar shape to the homologue of the male penis, where you have like a little, like a root-like thing here, and it goes into the main shaft, right? Which is made up of erectile tissue. Okay, so the clitoris, of course, is the and the head of the clitoris is obscured and hidden by the labia minora. So let me turn that around. This is the external genitalia here, labia majora, labia minora here, and you could see that the opening is this is a little bit of an opening. Let's highlight the vaginal canal, and you could see a little bit of the blue through the vaginal introitus. Now, we call it introitus, and the vagina is actually the muscular vaginal tube, but the introitus is the opening. And now you could see that the function of the labia minora and the labia majora is kind of a protective function. And it also highlights the reason why your vaginal canal has a decent amount of mucus in it. It has a slightly acidic environment. It has rugae and folds. And as we already learned from the part of the lecture when we talked about human chorionic gonadotropin, it also has a decent amount of immune system items in there to do what? Protect that opening. Okay. Let's get everything. Okay, now I have to bring everything back. Now, let's now talk about all the ligaments. You can see some of the ligaments here. They kind of like have the same color as bone. Now, let's first get some perspective. Okay, when we're looking at this of course is the anterior and lower section because you have the external genitalia down here. Then up here is what? Superior. So, top, bottom. So if we're looking at here, we already looked at the ovaries, right? The ovaries are being held up by your suspensory ligament. And they have to be the tallest thing that we have here when we're looking at female reproductive here. You look at it from this perspective. Because those will suspend the ovaries from the top. So, of course, here's your ovaries right here. Ovaries are so important, if I turn it on its side, that they also have, right here, they have an ovarian ligament that connects the ovaries to the uterus. So from the top, you have your suspensory ligament, and then the ovaries from the sides are connected to the uterus via this ovarian ligament. And of course, you have a right and a left. You have here the round ligament. If you see this round ligament, you see how it's going around? And we're going to see that a little bit better when we start looking at the simulation of Vicky pregnant. Now, the vaginal tube is the passageway, and the uterus and the vaginal tube is very important for passageway for future fetus. So we have 3 sets, both right and left, of ligaments. Now, of course, if this top, this bottom more anterior here, right? So this thing in the back is the uterosacral ligament. Let's put it in context. So it's in the back. And it makes sense because where's your sacrum? It's part of your backbone. And you have these here on the sides. That's your cardinal ligament. And these up front, right? This is your clitoris up here and your external genitalia, female genitalia here. So this is considered the front part, and that is your pubovesical ligament. So to review, in the back, uterosacral, in the sides, cardinal, and in the front, you have your pubovesical. Because where's your pubic bone? It's in the front. So that's all the parts. And we look at all these normal parts of Vicky, because Vicky was a 31-year-old G0P0, meaning she never had a kid and she never delivered one, patient. Now, let us minimize it. Go to the home button, then I click on minimize. And then I'm going to go to the next thing. Now, when you click on functional anatomy, and then you click on, I forgot. Great, now I'm forgetting. Click on functional anatomy, and you click on this, pregnancy, right? This will come up. Vicky will come up, okay? And you'll see the Anatomage team simulated pregnancy in Vicky. You'll also notice 2 sets of visibility tools. One that's blue, that's for baby. One pink, that's for the simulated mommy, which is Vicky. If you look at, if I click on the pink, right, you click on ECG, mommy's BP should be what? 60 to 100 beats per minute. Okay, you have your P, Q, R, S, T. We already know that. But if you click on baby, what's normal for baby? Maybe this is a little bit too fast, but you can see here. Baby's metabolism is much higher. Baby is growing. There's a lot of growth and development that's going on with this fetus. So the not blood pressure, the heart rate should be quite fast. Now, the thing that we also have to pay attention to clinically, just as a little side note, since I mentioned it in lab, is that decelerations. So consistency in the pregnancy and in, of course, delivery of the fetal heart rate is of prime concern, because any decelerations or any drop, let's say they're at 110, 115, and for whatever reason drops down to 90 and then back up, well, that's a sign that the baby is in distress, or future baby, the fetus is the better term, is in distress. Now, we can now, of course, turn on the blue dissection tool, and then mid-sagittal, and then we could do what? We could now see the positioning of the simulated child, right, which is in vertex. You could see, of course, a little bit of an outline of the cervix. You could also now appreciate the significant strain on mommy's abdominals and her lower back. You could also see how the sacrum is poised to act like a slide, if you will, or to facilitate the birth of this child. And then you can see how the size of the uterus also presses up on all the abdominal pelvic structures, and then of course that's going to press up what? On your thoracic structures. Okay? All right. Now, let's look at the third thing. If we go into your functional anatomy and then we can go to this, birth simulation. You will now get Vicky on this. And if we want to see the same dissection, but nice and clearer, you could see a clearer view of the fetus within the amniotic fluid, and then you have the placenta there, which we got to go back because I forgot to show that regarding baby. Skipping around a little bit. Let's go back. Forgot about the baby. Okay. So, if we take mommy out of the equation and we remove everything, right, undo the cut, you will have, of course, all the fetal products, right? So all of these things that you see here are not of mommy. And that was also the other thing that we're also trying to get at regarding the difference in heart rates, because they're two entirely different patients. So in obstetrics, you don't have one, you have two patients. You have mommy and, of course, future baby. Right here you see the umbilicus, or the umbilical cord. You can also sex the child. Of course, you see the scrotum, a little bit of the penis there. So it's a male child. Let's look at it from top to bottom. Here is where the cervix would be. This sac right here is the amniotic sac, which is most intimate with baby. And within the amniotic sac is the amniotic fluid. Another thing you'll also notice here is the placenta. You look at it looks like a turtle back, so it has all the pieces. So upon delivery of the afterbirth, which is all these other things like the placenta and the umbilical cord, they all have to be intact and have to be removed from mommy, because mommy is mommy, and all of these products are what? The fetus. Okay? Good. Now that I covered what I was supposed to cover. Now, do you see in the future in your maternity class, all these little dots will now have what? Phases and stages. Okay, so let's go. Don't really need to know it. This is for demonstration purposes and also a nice little introduction for your future maternity class. So let's press play. See what we got. So, do you see what has to come out first? Right? The amniotic sac broke, and then her water broke. Vertex baby, head, and then you'll have internal rotation. See how the baby kind of like turns inside, right? Now, there's crowning after 10 centimeters of full effacement, right? And then you're going to have external rotation. Okay? Then you can see how the baby is slowly progressing. You'll also notice the umbilicus is colored blue and pink. Of course, blue is the umbilical artery, and the pink part is your umbilical vein. And of course, what will be delivered last is your placenta, and your placenta as a whole. Okay? So that concludes our video, and good luck on your finals. See ya.